And because most times when these drugs are taken in, they are not measured, they're taking it, sometimes it may be an overdose, okay? And the active ingredients are such that even in minute quantity, different people can react differently to these substances. Wherever those sources are coming from, regulatory authorities need to step up and need to cut down those, clamp down on those sources.
She, however, called for sensitization amongst young people and the need to stay off Colorado, as some of them take it without even knowing.
Okay, and we need to also educate our youth out there that these drugs, sometimes they can be contaminated, sometimes it may not actually be what they tell you that it contains. They contain other substances that you're not even aware of. And this is because people want to make money. They want people to have that experience that will make them get even more outcome of the little that they have. So there's some ingredients that may be contained in those drugs that most times they are not labeled as having those things, and those may actually be what can be causing or leading to these excessive side effects.
Now, videos on social media have indicated that Colorado substance is common among recreational drug users in Nigeria. In the online videos, and this is the scary part because I honestly had the fear of God when I saw these videos, those who take Colorado either bark like dogs or walk around like zombies or outrightly collapse after displaying unpleasant behavior. It has always been known to cause death. A couple of years ago, I can't remember when, but not too long ago, I saw videos on YouTube about something called flakka. I remember it was crazy. But then, I honestly saw it at the time as this one Oyibo problem. Well, the videos I saw in connection with Colorado are now Nigerian problems. So to help us understand all that needs understanding, Pharmacist Oladigbolu Adewale is a fellow of the Pharmaceutical Society of Nigeria and the former chairman of that same organization, the Pharmaceutical Society of Nigeria in Rivers State. He joins us via phone this morning. Good morning, Pharmacist Adewale.
Good morning. It's good to be here.
Yes, it's always a pleasure. Thanks for joining us. How are you doing?
Yeah, I'm good.
Okay, so we're going to get into...
To the extent of general well-being, but when you consider Nigeria's situations and this drug abuse problem, then you can't be good. You cannot be good.
Pharmacist Adewale, we are all in that WhatsApp group. You know, that truck is carrying all of us, so we are doing our best to ensure that we're good. But by good, your state of health and mind is okay, right?
Yeah. Yes.
Okay, that's good. I feel that way too. So let's use our mental state to analyze the situation. All right. So before I get into Colorado in particular, because I know that there are many other drugs in the market with different names, how big is the illegal drug trade in Nigeria?
It is huge. Nigeria has a population of nearly 250 million people. And we are bottom rich, meaning that the number of youths far outweighs the number of adults that we have. And drug abuse, even though it cuts crosses all the demographics, is basically a youth problem. All right? We have a number of adults who are also suffering from drug abuse. But in Nigeria, it will interest you that the prevalence of drug use in Nigeria is about 14.4%. That is more than double the global average of 5.6%, according to the National Drug Survey of 2017. So, because 14.4% of Nigeria are abusing drugs, that means there's a market for it. That means now Nigeria can now be classified as a destination for illicit drugs. Before, it used to be a transit country for the movement of illicit drugs.
So other countries
can be classified as a destination of illicit drugs. So the market is huge. The number of people who are consuming it is very high. 10% of 250 million people is about 25 million people. And here we are looking at about 14.4% of people aged between 15 and 64 years taking illicit drugs.
And as you say, this data is from 2017.
Yes, that is 2017. And it will also interest you that this data does not even take into consideration people who are abusing alcohol. And I find that strange. It does not take into consideration people. By the time you had those who are abusing alcohol to this data, then you are getting a different figure.
That's truly sad. Now let's look at Colorado, which is the focus. What is it? How is it? Why is it? There are so many questions around it.
Yes, really, we the healthcare professionals, people who are in the news media like you, we need to do a lot of work. So we have a responsibility to tell people what we are seeing on the street. We have a responsibility to make sure it gets to every household that drug abuse is dangerous. It can lead to death. It can lead to heart failures. And so we need to do that on one hand. And then people in government also need to do their job. The socio-economic situation is not laughing at anybody. And then where you have that kind of stress, people can easily crack. They can easily let out into drugs. We are not finding excuses for those who are abusing drugs, but these are factors that can contribute to high prevalence of drug abuse in our society. And again, one of very, very important things is the security of the medicine supply chain in Nigeria. Because some of these drugs that people are abusing are actually useful drugs. Some of them are on the national list of drugs that could be used in Nigeria. But because there's no security for the drug supply system, you find out that these drugs easily seep into the society and then get abused. So it's a whole lot of things that are tied together. We need to work on socio-economic system. Healthcare providers need to up their game. Government needs to do more for security of medicine supply system in Nigeria. You cannot overemphasize that point.
Truly. Now, the description states that Colorado, which is a street name for synthetic cannabinoid, is classified as a psychoactive substance. I'd like you to break down that statement. What does it mean?
Okay. Psychoactive substances are substances that, literally speaking, they work on your brain to effect any change that they make. But when we are talking of psychoactive substances that are subject to abuse, it means that the more of these drugs you take, the more you want to take, so that you become dependent on it, so that your body tolerates it. These are two key factors when it comes to drug abuse: tolerance and dependence. Tolerance means that your body has learned how to stay with this drug, so that dosage that can kill ordinary people who are not abusing drugs can easily stay in your body. So for some people, for example, if they take 2 bottles of alcohol, they are down and they are out. It will knock them out. But some people who have been abusing alcohol over a period of time, you hear them saying that I can take a carton. That dosage, because it's his job, that one carton they are talking about, if you force it down the throat of another person, it can kill the person completely. So that is the concept of tolerance. Dependence means that if you don't take this medicine, if you don't take this drug, you are not okay at all. That's why you see some people when they abuse drugs and they don't have supply for that. You see them, either they are scratching their body, they are just not balanced, they are scratching their head, they are not balanced, they are not coordinated in any form. So that is the cycle of dependence. Cycle of dependence means that you always want to take this drug, even at the sacrifice of every other thing that makes ordinary people happy. So if you are married, for example, you know the kind of thing that you derive from marriage. It makes you happy if you are happily married. But somebody that is abusing drugs will sacrifice that marriage to pursue the drug. When you eat, you feel good with yourself, not so. Especially when you are very hungry. When you eat, you feel good. But somebody that is dependent on drugs is ready to sacrifice that food. It has no pleasure in it. When you make achievement, maybe you go to school, you graduate and everything, you score high marks in school, it makes you feel good. But somebody that's abusing drugs does not care about those things again because it's now dependent on the drug. So that's the extent to which you can describe it in a layman's language. Once people get hooked, they always want to take more. They are ready to sacrifice every other thing to pursue this drug. That's why you find people selling their houses just to fund their habits.
All right, so let's look at the creation of this. It is classified as a synthetic drug. That means it was made in a lab.
Yes.
Now,
yes.
If it was made in a lab, that means it was made with someone with scientific knowledge, at least to know what to mix and to what quantity.
Yes.
Was there any good use of that particular drug and then it was abused, which turned it to this problem, or was it originally made to destroy people's lives and brains?
Okay. Now let me tell you. You said it was made in a lab, synthetic. I agree with you, but it is made by somebody that is a scientist. I have my doubts.
With scientific knowledge, someone who knows what to mix.
Okay. With scientific knowledge, yes, because scientific knowledge can be gained by anybody.
Yeah.
You understand? So, specifically, these ones are not drugs in the healthcare systems. Don't forget, in somewhere in Delta State some years back, we found some people who are making amphetamine, which is another drug of abuse. Are those drugs going to enter national health system? No. So they are not made with the purpose of healing a disease, or curing a disease, or delay the bad prognosis of a disease cycle. So they are strictly made. This kind of drugs are strictly made for people who are dependent on it, because there is a market for it, and that is totally out of place. It is not good. So government and law enforcement agents should go to the bottom, to the root of this problem, to the places where they make these drugs, and dismantle their network.
Well, the government and authorities will have to find out where those places are in the first place. Now, let's look at the supply chain. Are these drugs made in Nigeria, or is it imported into the country? Do we have labs here?
Right now, I cannot say, but you cannot rule it out. You cannot rule it out that there may be somewhere in this country where these kind of drugs are being made. Don't forget that when people make this kind of drug, they use very crude equipment, and they do it in a way to offend the law enforcement agency. So you can't rule it out. Like I said before, Nigeria used to be a transit country for a number of these drugs, but now we're having a huge population of people who are dependent on psychoactive medicine. So there's a market for it, and like every market force, they may just as well come and locate that illegal drug synthesizing outlets in Nigeria, just to be close to the market. So you can't rule it out. It is the work of law enforcement agency to penetrate this network, break the network, look for those who are working together most of the time. But when it is synthetic, you have pinpointed one particular ingredient and you have made it more concentrated to be able to deliver on target in good time. So the synthetic, especially when it is illegally synthesized like this, it will be a very big problem in the body. Why? Because when you synthesize drug originally, you are not going to get only one chemical at the end of the day. You are getting several chemicals. So after synthesis, you still need to pass through a process of separation in order to purify the main active ingredient that you are looking for. You need to separate it from other products of the reaction that you have created. But in this case, these people can never ever be as sophisticated as that. So what the people are taking in the name of this medicine may be several very active chemicals together as one. So the synthetic, in my considered opinion, will be a very dangerous chemical to the body.
All right, Pharmacist Adewale, we'll be taking a break shortly. But the part that interested me the most, the part that kept me watching those videos on YouTube, is the reaction of those who abuse it. Patterns of barking like dogs and round like zombies. No kidding, that scared me. Now I understand the damage in a particular way, specifically barking and zombieing.
Yeah. One, most drug overdose will eliminate your inhibition. Anytime you want to do something, your brain goes through a cycle. Is this thing good? What do people say about it? You start using psychoactive drug. That barrier comes down completely. You can even walk naked on the street because the barrier is broken. You are not considering anybody's opinion. In your perspective, it is only how you feel good about yourself that matters. So Even ordinary alcohol, we see when people are intoxicated, what happens? Their inhibition is broken down. They can say all sorts of things. They can do all sorts of things. Not to now talk of very highly potent that we are talking about. So it removes that inhibition that the society possesses. Does not matter to them again. They are not considering it. They are not considering what you do. If they are their mother, they don't care. I've encountered somebody before, and I said, look, why do you do this? Because he told me of some kinds and all that. I said, why do you do it? He said, because before we go, we will have been so intoxicated with all manners of drugs. Whatever drug that you want to take, it's available for you. And I said, so? He said, so if you put your mother on the firing line, you are ready. So once that inhibition is removed, do all sorts of things. Where they abuse this drug is such that it promotes that type of behavior. Do you know that the next day they even gather to mock themselves about how they behave the previous day when they were intoxicated? So it is that primary inhibition, that thing that God put in you to consider other people's opinion, to consider the values of the society, that is broken down. And once it's broken down, you can do all sorts of things.
Yeah, you truly can do all things. I'm not sure what strengthens you in this case, but you can.
Yeah.
Well, Pharmacist Adewale, we need to take a break. After that, you and I will talk about solutions because we have to go somewhere. Thank you very much, sir, for making the time.
Thank you.
Don't go anywhere. Still 92.3 Nigeria Info.
The Morning Crossfire.
This is an infomercial. On 92.3.
That is okay, which marijuana also falls into that class. So this the cannabis is the natural one. So this Colorado probably is a synthetic form, and that means that it's man-made. And because most times when these drugs are taken in, they are not measured. They're taking in, sometimes it may be an overdose, okay? And the active ingredients are such that even a minute quantity, different people can react differently to these substances. Wherever those sources are coming from, regulatory authorities need to step up and need to cut down those, clamp down on those sources.
This is the Morning Crossfire on 92.3 Nigeria Info.
Welcome back. It's still the Morning Crossfire. The words and voice of the spokesperson of the Association of Public Health Physicians of Nigeria, Dr. Oge Isokariari. She was talking about Colorado. Colorado is a street name for synthetic cannabinoid and is classified as a psychoactive substance. It is also known as, and you want to pay attention because there are lots of names here, Black Mamba, Amsterdam Gold, Devil's Weed, X, Mary Joy, Annihilation, Thai High, and Hawaiian Haze. Lots of names for destruction. Well, our guest is still with us. Pharmacist Adewale Oladigbolu. He is a fellow of the Pharmaceutical Society of Nigeria and was the former chairman of that society in River State. You're welcome once again, Pharmacist Adewale.
Thank you very much.
All right. Now, we know that young people, they make up a large percentage of consumers of these illicit drugs. One part of this that concerned me, in an interview with someone who used to be an addict, he stated that some vendors tried convincing innocent teenagers into believing that these drugs would boost their brain activity and make them excel in their academics. Let's look at that window. Customers that may come from people who are really trying to just get ahead in school, and they tell them, oh, this will help you memorize better or understand. The market for that type of drug that actually helps people do better with reading and excel academically, does such a drug exist?
No. The answer I will give you straight is that it's no. You understand? No, because you do not want to. Once you say something works for this purpose, what you are saying is that the benefit far outweighs the disadvantages. But with this case that we are considering, we all know that the disadvantages far outweighs the benefit of the drug. So there are so many drugs, but before the past regulatory red lines, it has been observed that these drugs are safe. No matter how powerful a drug is, if it is not safe, then it cannot be approved as a medicine for use. So that's an area we don't even want to go to at all. Once it's a drug of abuse, even if it is a drug that is so good, but it can create dependence, it becomes a classified drugs, and there are formats for pharmacies to dispense those classified drugs. As a matter of fact, every pharmacy you enter will have what we call a poison box. Somewhere, some medicine with certain degree of dependency are supposed to be locked up, and then you keep the key as a pharmacist. So for the case that we are considering, the answer is no, no, no. We can't even begin to talk of the benefits when we know that this thing can lead to death, when we know that it is a gateway to other diseases like HIV, hepatitis B, and all the rest. So we cannot begin to talk of what the benefit is. And again, this is an illegally synthesized drug. We are talking of illegally synthesized drugs. So we can't talk of benefits at all.
All right, let's look at the efforts put in place to curb these practices. We know that the NDLEA and NAFDAC are the ones that cover this sector. How would you rate their efforts so far?
I would say they are trying, but the effort is still a bit short of expectation, because the prevalence is very high, and these agencies most of the time are even underfunded, and this is something that across the sector. For example, drug abuse has something to do with national productivity. You can't have 14% of your youth on drugs and expect a better performance of the economy.
Truly.
It has something to do with crime. So it's a collaboration between agencies. I wish that the federal government would bring out a structure that allows NAFDAC, NDLEA, the Nigerian Armed Forces, the Nigerian Police, the civil society to interact together on this burden of drug abuse in Nigeria, because it cuts across sector. Right now, what we are having are suboptimal services. Recently, you can see that NDLEA, they are making large seizures. They are arresting a lot of people.
Yeah.
So they have upped their gains, but this is still far short of what we need to do in this country to get the situation under control.
All right, finally, Pharmacist Adewale, how easy is it to get someone off addiction of any of these drugs?
It is possible, but it is something that has to be done consistently. For example, most of the time we talk of people who have suffered or who are suffering from drug abuse as being in recovery. That means we must be eternally vigilant with such persons. Because under stress, the person may buckle and then go back into drug abuse. So we say they are in recovery, not that we have treated them. So we are eternally vigilant, and we also make the people who have suffered from this drug abuse to understand that, look, you just have to be careful eternally. So that's why we preach that people don't get involved. So the efforts around it is one, we try to offer prevention services, effective prevention services, so that people who are on the fringe don't go to the other line and then begin to abuse drugs. Then we continually work with those who are suffering from drug abuse, continually, because they are said to be in recovery. Because one, they should not be subjected to the same condition that try to promote them into the cycle where they abuse drugs. And then the person will be vigilant not to go back into drug abuse. So it's doable, but it is something that needs continuous vigilance.
All right, Pharmacist, I know I said finally with the previous question. Now, finally, for the final time.
Yes.
If people find themselves around someone who is reacting crazily, because most of the videos I saw had people pouring water on, those guys, and I don't know if it has any effect. What would be the first response, for those who are around someone whose engine is about knocking? What must they do immediately?
Honestly, the first response is to get in touch with healthcare provider. And permit me the opportunity to say this. Pharmaceutical Society of Nigeria and Rivers State is currently working with the Benoni Losses Center for Drug Abuse Reduction Services. One of the things that we quickly want to do is to get the phone numbers of people who are capable of handling a sufferer of drug abuse, to get their phone number in the public space.
Okay.
So that when you encounter such people, with a phone call, you just call the people who can come and calm the situation down. At that point, once you make a call, then the next other thing that you can do is remove every form of dangerous object from that environment, and confine the person. once you confine the person and you make that call, it is expected that people will come and rescue the situation, right? Literally speaking, I don't know what pouring cold water on that person can do for that person, because we are talking of an intoxicant that has gone to the brain, right? So what we want to do, restrain the person, make sure that there is no dangerous object around that person, and make that phone call. If you can't make phone call like we have right now, what you have to do is to get the person to the nearest facilities where they can tackle the problem that the person is suffering from.
Well, thank you very much, sir, for your time. We truly appreciate it. Have yourself a wonderful day, sir.
All right, and you too. Okay, bye-bye.
There you have it. 14% is a lot. That's really huge. Now, a couple of stats. I think I saw this. This is from UN Drug Use Reports from 2018. It states that Lagos, Gombe, and Oyo states have between 21 and 33% drug abuse prevalence compared to the rest of the country. So it's in other parts, but these states make up this percentage. 1 out of 4 substance abusers is female. Now this is from 2018. That means a quarter of drug abusers female. It also says that the daily expenditure on cannabis is $1.15 million daily. Wow. And the average drug user spends 417 naira 45 kobo daily. So almost 500 naira every single day. There's an app I have on my phone where I do daily savings. I started with 500 daily. At the end of a month, that money can do 1 or 2 things for you. If somebody spends that every single day to get high. Anyways, I'll just leave it there for you to do the thinking. But while you're thinking, I also need you to respond. The implications of drug abuse in Nigeria. Have you felt it? Is anybody in your area? I'm not saying you should mention names. Who you know is doing 1 or 2 and you've seen them act some kind of way. What level of damage has this caused? 0817-923-0002. 0817-923-0003. 0817-923-0007. WhatsApp and Telegram 080-903-0646. We are live on Facebook. That's facebook.com/Nigeria InfoPH. Please turn off your radio. As you call, this morning we're talking about Colorado, but I know there are many other drugs on the table. IK Ikechuku says some call it solid water. From some of the takers, they said when taken, they cannot sleep for 3 days. It's bad and damages the brain. Wow. Amen. Arras someone says you don't need drugs to feel high. Be yourself. Yeah, that's what an ad on TV, say no to drugs, should sound like. You don't need drugs to feel high. Be yourself. Take that to schools and tell the young people, those who call the leaders of tomorrow. Say this does not get you high. You get high on life. All of them will be shouting. But hey, the situation is terrible. I kid you not. Destiny calls from Andoni. We'll be speaking with Destiny shortly. But I believe I have comments on WhatsApp. Okay, so let's take that call from Destiny. Good morning, Destiny. Ah, damn, I lost that call. Hello, good morning.
Good morning. Good morning.
Good morning, go ahead.
All right. Yeah, I wouldn't want to mention my name and my location because of what I want to say.
Okay.
It's personal. Yeah, I have a brother who just came back abroad. So I keep noticing some funny behaviors. And I was like, guy, what's the issue? So just recently, he confided in me that he's having withdrawal symptoms. And that is my first time of hearing such language. I was like, what is withdrawal symptoms? And he never told me anything. He said, it has been perturbing me. Ever since I tuned on my radio when I was taking my daughter to school, I've been following this particular topic to this moment. So I need advice. What do I do? How do I help this young man? Thank you.
All right. Well, as my guest said, you need professional help. You'd have to, with his permission, allow you take him to a medical professional so that they can advise based on his particular situation. But it's bad. I can tell you that for free. It's bad. And my fear, and this is a real fear, is that people start out really young. I mean, there's no age where it's okay to abuse drugs, but when you see those who are below the age of accountability, people in secondary schools who cannot even vote yet, they've been addicted for like 2-3 years, it scares everything. And they do that for a decade, it's almost impossible to get them off. I'm also concerned about the names. I don't know how they come up with these names. Colorado has always been somewhere in the US. Now it means something in Nigeria. There's Black Mamba, Amsterdam, Gold, Devil's Weed, X, Mary J, Annihilation. Who gives these names? Well, Daniel joins me from Imo Gate. Good morning, Daniel.
Good morning, Jude.
It's Sam.
Chinke Daniel Imo Gate.
Go ahead.
Yes. The substance we are talking about, I don't know. Because the one I see young people, even up to the age of 40, they are taking around me here. I don't know if it is in that class. They call it ICE. I don't know whether it belongs to this Colorado. But I have to blame our government. Yes, as we call on radio, it's like everything we blame the government. Yes, we as parents, we do try to guide our children, not to do those things. But you see, they copy their affairs. But it is in the ambit of our government to try and stop these things, whatever source they enter into our country. So actually, if you see the harm this thing is doing to our society, you can't believe it. Rape, all these kidnapping here and there. If people don't take this substance, they won't get into this crime. This is what they say, it gives them morale. And my mother used to say, somebody that is not ashamed can do everything. That is adage that my mother taught me. So because they take this thing, they are ready to go naked, and they are ready to do every other thing, criminally or otherwise. That's my take this morning. Chike Daniel from Umogetosa.
Thank you very much, Daniel. Temple calls from Rumasi. Good morning, Temple.
Good morning, once again, a very distinguished officer.
Can you speak up, please?
Can you hear me?
Yes, I can. Go ahead.
Yes, I sincerely, take this news as this comment as a very bad one. Distinguished Oracle, the NDLEA are they not up to their game any longer? Because when you look at the happenings within my own area, Eche, we talk about Imo talk about Umeche, the level of drug abuse and all the rest of them. Sometimes people talk about this age. You look at 10, you see 11, 12, 13 years old boys. Some of them are not even interested in going to school any longer. They even see any drug these days as an advantage to take it in excess to the extent of getting hurt. And for me, sometimes these security agencies get rid of them. They take them along the road, they snatch, they collect their phone, collect the remaining shishi that is in their pocket, and they allow them to come back home. Which is not even helping matters. And you see the drug enforcement agency on their own doing business with it. Because for me, it is down back to the people that are supplying this thing. My brother, if there is no supply, I don't think that there will be people that will patronize them. Because if there's any room for people supplying, definitely they must get customers that will come and patronize them. And that is where it falls back on the society. Customer, you see boys here going mental, running mad on a broad daylight. You see somebody going naked. He can't even see any longer. Somebody is standing but he's sleeping. You see somebody standing but he's sleeping. Is it normal? Very unfortunate too.
It's not Temple.
Thank you.
Well, thank you very much. As much as you and I might want to blame the NDLEA and all agencies saddled with that responsibility, we must admit that they are overwhelmed. If the stat by Pharmacist Adewale is anything to go by, 14% of over 200 million people is a lot of people. So what can we do? Security is our business. This is a security threat. every parent should take care of their own kids. Let's start from there. Because I know there are lots of kids now who are hooked on drugs and their parents do not know. Well, there's the excuse of we're busy. There's a business to run. There are bills to pay. Please pay attention to your own. If I do that and you do that, then 14% might become 0%. Thanks for being a part of the show. It's been a wonderful run with you. Connect with us at Nigeria Info PH on all platforms, with moi at Sparkling Oracle on all platforms. Coming up at 9 is Hello Port Hackett with Jude. You don't want to miss that. Have a wonderful day.